Welcome to another tutorial on SuperMed software. Today I want to talk about the antenatal clinic section for doctors. Assuming we have a patient who has come for antenatal review, you normally go to your doctor's section and click on O&G Consulting. And you select the patient from your list of patients, and you have this page. The vitals would have been entered by the nurses at their station. You normally enter your complaints if the patient has any complaints. Direct questions, you can enter your obstetric history if it's not been entered already, and a few others. At this point, you would come to the A&C progress, where the nurses would have entered most of these, or the midwives would have entered most of these. That's the BP, the urine protein if positive, the gestational age, the symphysophundal height, and etc. So all these will be entered. You can enter the HB level. If you have any scans and you want to enter the summary, you can enter it here. The special medical conditions, if the patient has some, you can request for labs and you can add prescriptions. As you scroll down, you see the antenatal progress for all the hospital visits of the patient for this particular pregnancy. Here I've just entered some dummy data because of time. And then you also see the obstetric history. This patient, for instance, might have had twins. The first twin was a male, the second twin was a female, and they had the same birth weight. You would also see the risk factors if a patient has some. These would have also been recorded at booking for this patient. So she's para 4. She's had 2 previous cesarean sections. There was a postpartum hemorrhage. She's not a sickle cell patient. She's not had any myomectomies. The HB electrophoresis has not been done yet. And then other diseases that were also recorded at booking would also show here. So every time you are seeing a new patient, or you are even seeing an old patient for review, you would have all this information right there as you also clock your patients.